And we are recording this, so if you have to miss any part of this, you will be able to go back in and hear it later. So I wanted to start with just sort of the dictionary definitions of grief and loss. And grief and loss is defined as deep sorrow, especially that caused by someone's death, the fact or the process of losing something or someone. And I really emphasize the word process because for people who have chronic illness, and particularly with GNEM, it's something where it's not just a sharp dividing line where you're well and then you're not well. It has been for, I think for everyone, a really prolonged process, probably a long time in terms of getting diagnosis, figuring out really specifically what's going on, and a lot of guessing and educated guessing about what is going to happen and what is going to be changing. And so that sets you up for a lot of complications. And when I say that, I'm talking from a clinical perspective. So I'm a psychologist. And the different types of grief that we talk about, we have acute grief, which would be something like where someone you love got in a car accident and died. That's a very sudden, a sort of sharp, unexpected thing. Prolonged grieving, which can come from having a chronic illness or knowing that someone is terminally ill, dying. So that goes on for perhaps many, many years while a person goes through cycles of hope and expectation and disappointment. Chronic grief, similarly, and I think that's mostly what we're dealing with here, is that there's a series of losses, and they don't necessarily have to be major losses like someone's immediate death or loss of a job would be a big loss, for example. But there's a series of losses that may include all of those things, and they are part of the complex grieving. So when we get to complicated or complex grieving, we're mixing up all different kinds of grief. Some of it is about life, lifestyle. Some of it is about very specific activities or actions, things like physical abilities, obviously, in this case. And then hopefully we get to a place in healthy grieving where, and there is healthy and unhealthy grieving, I'll talk about that in a second, where we have what we call integrated grief. And so the aim is to kind of process your way through the grieving. And while you're dealing with it, you're also integrating it. And that is something where with the complex grief, you don't know. I can't tell you what the exact process is going to be. I am going to talk about the process though, because there's some expectations about what grief looks like. But we're hoping for something where it just becomes part of living. And the one thing that we all end up doing is living and dying, right? So the dying part of it is a lifelong process. The minute you're born, the minute you begin dying also. And so I would like for us to start to look at the grief as just a normal, natural part of our emotional process, not something to be rejected or pushed away or denied. So the invisible losses in GNEM are significant. And of course you would say, well, they're not invisible. People can look at me and see that I'm wearing leg braces or I'm using a chair for mobility. Or I cannot do something with my hands that I used to be able to do. So those things are the very visible losses. But the bigger stuff that we look at in all forms of chronic illness is this idea of the loss of health. And you started out at some point, presumably, as a healthy child, infant, young person perhaps, and then started to have these things that appeared to be changing. And over time, you eventually got this diagnosis that landed you in this place where we are today, which is identifying as having this disease and having this loss of health. And along the way, the loss of control that has occurred with that, I think, is one of the things that emotionally we don't talk about a lot, because really most of us are striving, and hopefully our parents all raised us in such a way that we were able to launch out of childhood, out of our family home, out of our family into adulthood. And we were supposed to be in control. We're theoretically healthy, happy, functional, educated, and getting on with our lives. And there's a plan. We're supposed to go out and go to school, get jobs, get into relationships, have our own families. And what happens then when you don't have the ability to do some of these things, or sometimes you have the ability to do none of these things, depending upon how severely the disease is affecting you. And we are having some technical difficulties, which are not manageable very well from my end, and I really apologize. I've had some software glitches. I'll keep flashing back in. Loss of control. What a perfect segue, right? We can't control all of these things. Unfortunately, the technology thing is really beyond my control sometimes. But with that loss of control, there's a lot of fear that arises and a lot of anxiety and changing expectations. The idea of a well laid out, well planned life is no longer something that you can hold on to so tightly, because all of those things are changing in ways that are not preferential for you. Along with this, particularly specific to GNEM, is this loss of autonomy. And by that, I mean autonomy, autonomous functioning, solo functioning. Over time, there is an increasing dependence on other people to assist you physically. And this is really frustrating. I know from talking to many patients over the years that it is something where you are sitting there thinking, wow, my brain knows exactly what to do. My body just doesn't follow along. And so the increasing dependence on other people. And I was asked to address the issue of caregivers, because caregivers are so important in GNEM. And with that, there's not just the loss of relationships, but there is the radical changing of relationships. So for many people, they may have already been in some sort of romantic relationship, and that changes from romantic and partner type relationships to the role of caregiver and the person who is receiving the care. And that is a really, really dramatic shift in relationships. It's something also where you may find yourself not necessarily paired off in a romantic relationship, but what you are dealing with perhaps is something where you are going back into your family that you came from. And so even though you're an adult, you've got your parents who are now taking care of you again, when what we expect is the shift, which would be that over time, perhaps as parents age, you would be taking care of them, and that may not be possible anymore. And so those things are very, and similarly with that, you might also have a situation in which you have children and you would expect that you've taken care of them, and you repeat the same pattern. You send them out into life to do their thing, and now they find themselves in a position of being premature caregivers to you. And so all of those things are part of the invisible losses, and we don't get to talk about them a lot, and they're often very slow sort of progressions. Sometimes there can be things that happen that can be really sharp, sudden shifts. Again, like the example of someone who gets in a car accident and perhaps loses their lower limbs and becomes paraplegic. That would be a very sudden dynamic. All of a sudden that person has the shift. Whereas here we're looking at a much more sort of slow and subtle shift. But again, we don't know how to anticipate. We know that things will change, that things will get worse, or that more capacities or abilities will become lessened over time. But it's hard to know what's happening, what to expect of people, what they should expect of you, all of those sorts of things. Within the category of invisible losses also is the loss of hope, because I've been with you guys now for a few years at the conferences, and what I've seen is that there's research that's exciting, and then research that falls through, money sources that come through for funding more research, money that falls through, ideas about what may be causing the problem or how we can cure it, and those things don't pan out. And I think as that cycle happens repeatedly, which is just the nature of chronic illness and medical and scientific research, that there can sometimes be this loss of hope. And hope is the thing that we tie into our will to live, our desire to live. And there can be an okay part of the loss, which is if you can give up on unrealistic hopes. And I'm not going to define what realistic or unrealistic is, only you can do that. But Sometimes that allows you to live with a little bit more of clarity and drive, operating independent of these potential outside sources of a cure or a solution. So I like to start looking at grief and at loss as they relate to a chronic illness in ways where we're looking at the situation of grief and loss, not just as kind of the surface, which would be, oh, this is terrible, it's horrible, I'm being deprived, I'm giving up things, I'm losing things, this is awful. And this also applies to when there is death. But there's also the positive side of it, and the fact that this is part of all of our collective life experience, and looking at it in a broader sense, kind of a more existential way, by which I mean we're looking at the big questions in life. Why am I here? What is my purpose in life? Why are these things happening to me? And so that also leads me to the discussion of loss of sense of self. And what do I mean by that? Well, again, I mean by where we start out as defining ourselves as these individuals, autonomous beings. Culturally, well, many of us may actually exist in a culture that really values and prefers family and a collective sense of unity and managing and approaching life. We still are all taught to be individuals, individual personalities, individual behaviors, individual preferences. And when you begin to lose some of your physical ability to manage things in life, you also lose some of your choices. I was very touched talking to a young woman at one of the conferences whose husband has learned how to do her makeup properly, for example. And that's something where, as a woman, this is maybe something that's important to you, maybe not, but it's a very personal thing to do your makeup, do your hair, do your nails. To not be able to do that in a way that fully expresses you, or that evolves or changes over time in the ways that you would do, and have to depend on someone else to imitate who you are for you, to recreate that for you, for someone to create, serve, process, and prepare your food for you, because you may not be able to do something as simple as managing to lightly salt your food, is another thing where there begins to be loss of self and more of an integration of, we are operating as a unit, we are interdependent, and sometimes that can feel like the term codependence, which is an unhealthy sense of dependence. But when you've got this sort of an illness, where you literally physically cannot do certain things past a certain point in your life, then it becomes a necessary dependence. So while the physical necessity is there, the emotional part of us is often slow to catch up to that. If that doesn't make sense, somebody pop in with a question and Amy will make sure that I see the question or hear the question. And I'll continue talking about that a little bit more. But those are the invisible losses. And I definitely, when we get to the Q&A period at the end of this hour, would love to hear more about what your sense is of this. Within grief, there are many of the obvious signs that we all know about, which would be crying, feeling sad, feeling lonely, longing for what once was. Those things apply to both death and other people's illness or losses. This might be something that you experience grief in when you lose a major life experience, like getting left at the altar, or having your mother die, losing out on a job you wanted, losing a political race. Those are kind of the big things. There are many, many other things that we may grieve. It may be that you're shopping for a house and you really fell in love with a certain house and you lost out to a higher bidder. And there will be some grief about that. So again, this is something where, rather than carving out grief as this standalone, horrible, awful experience that we want to run away from or get it over with as quickly as possible, looking at it more broadly as something that's just part of life. Every day probably holds a little bit of sadness. Right now is daffodil season. at least in Los Angeles. And I love the daffodils, but every week the daffodils that I buy fade out and have to be discarded. What's next though? More daffodils for a little while, or more other flowers for a little while. So other symptoms of grief, because I think, again, this is something where when you're dealing with illness in general, with GNEM, is that you're kind of focused on day-to-day life and functioning. And what we don't look at is some of the other stuff. And something, just a technical thing coming from a psychological perspective now, is that after as short as a few weeks to a couple of months, we now diagnose people with depression, not with grief. Personally, I think that's kind of ridiculous. A typical grieving process is going to take a year or more, unless it was a very shallow relationship, like, say, a colleague in the other office died. Then you might very well have a super brief grief process. But we see other things that are happening. So insomnia, which may also be part of the physical illness, but it's often a symptom or an indicator of grief or depression. And insomnia can be a multi-part sort of thing. It's problems falling asleep, problems staying asleep, or problems with early waking or frequent waking. It could also involve things like having nightmares. And some of this also gets complicated in with the physical illness part, which is there may be medications you're taking, or because you are unable to get as much physical exercise as you would like or need, you're not burning off some of the energy, or because of exhaustion and you need more sleep and you get disrupted sleep cycles. That's a really tricky symptom, but just know that if you're dealing with that, part of it may be about grief, which is a little bit unexpected. Similarly, something that we see in grief is rumination, which means going over and over and over things in your head. It can be part of anxiety, part of depression, and it is definitely something within chronic illness where I see a lot of people, and especially with grief issues, thinking, I wish, what if I had done something differently? What if we had known earlier what my diagnosis was? What if I'd had a better doctor? What if I'd had better insurance? What if I'd had more doctors? What if there was more money here? Then would my problem be solved? And I know this is an especially poignant and painful one for people with GNEM, because it is something where the outcome is so difficult to accept. And so always we're prone as humans to thinking. And sometimes it gets into this really circular sort of thing that is actually contributing to physical exhaustion. So those feelings that we have are potentially part of grief, not always. Anger and outrage. You may have heard the denial, anger, bargaining, depression, acceptance model for grieving. It's important. It's most specifically useful for someone who is actually dying from an illness, but it's also part of most grief, which is anger and outrage over the symptoms that you're having, the losses that you're having, the physical changes that you're having, the emotional changes, the inability to solve problems in the same way, sometimes that where it gets connected in with the physical. Of course, anger about the frustrations of things like disability access, handicap access. Our world can be a really unfriendly, unforgiving place when it is not properly outfitted for you. Also, anger over access to services could be part of this, and access to certain activities or events. So, for example, we would typically see that a movie theater has special seating for people who are in wheelchairs. But what if you're in an old theater that doesn't have that? You might not actually be able to go see the event because of the way the theater is configured. So these small sorts of things that pop up that can feel very big and contribute to this sense of grief and loss are pretty powerful. And I think of them as like, well, we can get over this, right? a small thing, it happened, whatever, it's fine. But when you have this cumulative buildup of, I can't do this, I can't do this, I want to do this, I can't believe that I can't get into that building, right? It is something where you may think, all right, I've just got to be grateful. I can still do these other things. But over time, there can be a lot of anger about that and a lot of really righteous outrage about what is going on in your body, in your illness, in the world that affects your ability to participate in life. Avoidance can be another part of grieving because these sorts of painful experiences that I'm talking about, they are painful. They're hard. They're hard on you emotionally. Sometimes they might be hard on you physically, but they're really hard on you emotionally. And regardless of what your personality is, if you're a positive person, an optimistic person, a happy, outgoing, happy-go-lucky type of person, still at some point it may be something where you get frustrated, you give up, and you start to avoid because life is just really, really difficult. And it is so much more difficult when you are dealing with some physical limitations. And so this also may be something that's kind of, it's a pretty invisible sort of symptom, which is you just say, no, thank you. No, I don't think I want to go to that party. But in your head, you know it's because that house is impossible to navigate, or there won't be someone available to help you. Substance abuse is another symptom of grief. And this is part of the avoidance potentially. So substance abuse could be the obvious things like drugs or alcohol. They could be less obvious things like shopping or sexual expression like internet addiction, pornography addiction. Could also be something like being addicted to playing, I don't know, whatever a popular video game is. Candy Crush on your phone is something that comes to mind. I've seen a lot of people who actually spend hours a day doing that. So substance abuse is always a way of numbing out, of avoiding, of decreasing the pain. And when you have something painful like grief and loss, this may be something that you turn to in order to make your life feel more comfortable, to make your brain feel more comfortable, to kind of soften how painful all of this is. Similarly, irritability is a really significant symptom of grief and depression. It's probably one of the less well-recognized symptoms of depression, but within the field of chronic illness, I see a lot of people who have a lot of irritability, and this is often in response to things that we easily understand, say having to go a mile because there's no proper curb cut for you to navigate being on the street. And so that's something, pardon me again, we're having this technical problem. Okay. The irritability is something where it can be a response to having a situation that is problematic, and that totally makes sense that you're having the irritability, but it also could be a much more subtle form of irritability where you are impatient with yourself, impatient with the situation, or impatient with a caregiver. And unfortunately, because of being in a situation where there's often dependence on caregivers, it's something you don't get to express very well, or you feel maybe like you shouldn't express it, or you can't express it as strongly as you would like to. And so that kind of chronic low-level irritability is a big indicator that you may be having some grief and loss issues, or potentially even depression. And again, I don't like to call grief or loss depression too quickly and easily, but do know that there is often depression that comes along with chronic illness. So some of the emotional experiences of grief I've already touched on. I'm going to go through this list, which is by no means a complete list, but certainly sadness is an emotional symptom of grieving, and we're all familiar with what sadness is. It may look a lot of different ways, including irritability, including avoidance, including the obvious things like tearfulness or just a down sort of mood. Similarly, anxiety, you would think, that's kind of the opposite energetically of depression or feeling down. It's more that up feeling, but where anxiety comes out is that if you're actually dealing with some depression, you've also got some anxiety going on. They're like best friends. You just can't completely separate out anxiety from depression or depression from anxiety. And anxiety can look like elevated energy, that mental spin out, that rumination thing. It can look like irritability. It can look like frustration, short temper. It can look like sleep problems. Anxiety and depression are really complicated. And fear is another one of the emotional experiences that we have within grief. I think when it comes to this particular illness, it's something where the fear of the future, I know it's something that's come up when we have discussion groups, is what is it like to be thinking about what the future looks like for me? There are so few people with this disease. It's really hard to accurately predict a timeline, a progression. What will happen next? What will I lose next? And that's something that is really major, I think, in this particular situation is that fear, that anxiety coming in. Also in grief, we talk about longing for what once was, perhaps longing for who you once were or how you defined yourself. Most of us define ourselves through our roles in life as a wife, a mother, a husband, a father, a brother, a sister, a cousin, an employee, an inventor, a writer, whatever that may be. And many of those things will change over time as physical abilities change. And so the longing for the person you used to be or the life that you used to have, perhaps when you were able to work full time instead of living on disability payments, or the life that you once had when you lived independently as opposed to needing to have a caregiver with you at all times. There can be a lot of longing for those sorts of experiences that will never be your experiences again. And while it's true that all of us over the course of our lifespans will go through physical changes, temporary disabilities, emotional ups and downs, those experiences get exacerbated and they become something where you have a much keener awareness, I think, of what you are currently missing or what you will be missing out on in the future. And that contributes to sadness, grief, loss, anger, again, about that is a big symptom of grief. And I think it's reasonable and appropriate to be angry about what's going on in your body, in your brain, in your medical world, in the world of research, in the world in general. I think there's a lot of stuff to be angry about right now. And so those things also fit into that grief picture. Along with pain, the emotional experience of pain is hard to describe, but it could be that sense of longing, of sadness, of loneliness, of stuckness, like feeling really stuck in your body and your brain, the hopelessness and the helplessness that goes along with that, feeling like wishing that you could fix this, knowing you can't fix it, and having to depend upon others to fix it as much as possible in the moment is also something that, to me, even when I talk about it, I feel a heaviness and a sadness in the middle of my chest. And physically, I didn't list this as a symptom, but some of the other ways that you might know that you're feeling grief, sadness, loneliness, you might notice things like a constriction in your upper chest area. Perhaps in your breathing, maybe you're only breathing into the top half of your lungs, not all the way down deeper, which again is something that it can happen because of what is going on physically, and it produces an emotional symptom. So this is kind of a double whammy, and it's incredibly unfair, but it may be something where it's literally harder to breathe through and move through some of the feelings because of what is going on in your body. Shame as part of grief. Although you did absolutely nothing to cause this illness or make it worse, there still may be shame or embarrassment about the changes in your body, the changes in your capacities. Like being chronically ill is a lot of hard work. It takes so much energy. You are probably tired a lot, and yet you may still feel like you should be operating more fully than you currently are in the moment, or that you should be able to do more things because you see other people who are still doing whatever it is that is bothersome. But it's again one of those kind of subtle symptoms of grief. And I'm staying specific to the illness as opposed to other things, but it can apply in a lot of different ways around what has happened. Maybe you had symptoms and you ignored them for a long time or denied them and didn't seek medical care, and now you think that life could have been different if you had sought care earlier, for example. There can be shame around that. Loneliness is another big part of grief. Of course, if you are going through the experience of someone dying, you are going to miss them. You are going to have loneliness. But there's also this sense, particularly with rare illnesses, that it's a very solitary experience. Almost no one can understand what you are going through. This is really isolating also. And unfortunately, when there are physical limitations, like in terms of travel, thank goodness for the internet and the fact that I can be sitting here in Los Angeles talking to you all around the world at this point. That helps to decrease the loneliness, but still, when you have a very unique and specific presentation of a disease, as so many people do, it can feel very, very lonely and very hard. Like no one really gets your experience. And that's true. No one else is living in your body. That can also lead to some resentment, resentment towards the medical system, the research environment, other patients, doctors, caregivers, of course, all natural parts of the grieving experience around chronic illness. But I also want to look at this again as a complete experience, because I do think of grief as having the potential to be transformative. And so, what about these other things that are possible? Joy is still absolutely possible, right? You still have all of your mental faculties, your personality, your sense of humor, your ability to observe and comment on things that are happening in life and your experiences of life. And this is a little probably politically incorrect, but I've always found that there's a lot of joy and laughter sometimes in dealing with chronic illness situations, because there are just going to be symptoms that when you can remove yourself from them for a second, they're actually kind of funny. And one of the other things that I do is I work with people who have lost a family member to suicide. And I tell people when we come into groups that it's hard to believe, but at some point in the next few weeks, we will have laughter about suicide. Well, if we can even, and this always is 100% true, by the way, if we in a few weeks can get to a space of laughing about something associated with suicide, why can't we laugh about something associated with GNEM, right? Or any other disease? And I want to acknowledge also that while this is the focus of this particular seminar, just because you have this doesn't mean you don't also have other illnesses. So I know that there are many people who are dealing with things like hypothyroidism or diabetes or perhaps an autoimmune disorder or something like that. So what I'm saying is very specific to GNEM, but it's also something that applies more broadly to other chronic illnesses. So just want to acknowledge that you may not be just a GNEM patient. What about the relief? Sometimes there is huge relief in just letting go, surrendering to the fact that there are going to be losses. There's going to be grief that is going to happen in this process. And when you can accept that and stop fighting it, and it just becomes part of what you do, it's like, oh, great, here we go. Well, there's another thing I can't do today. Fine. It is what it is, right? And I know some people really hate that expression, but I think it's kind of a useful one. There can be a real peacefulness about that. And that is very different from, I think, resignation. Resignation has a bad tone to it. It sounds like you're giving up or giving in, but it can also be the thing that brings the peacefulness, the joy, the relief. That it's that calm acceptance and the state of kind of surfing the waves of emotion that go along with all of these losses and all of this grief and really all these changes. Because as human beings, we're pretty wired to want things the way we want them to be. And so when you can accept that a whole bunch of life is not going to be what you want it to be, then it is much easier to look at things with curiosity, kind of having a contemplative attitude. I wonder what's going to happen with this tomorrow or next week. I have no idea. I'm pretty sure I'm not going to like it, but I'm just going to be curious about it and see what happens. Maybe it won't be as bad as I think it is. Maybe I can manage it better. Maybe there will be more tools. Maybe there will be a better drug that comes around, or a better medical procedure or physical therapy procedure or tool that will actually help me in a way I can really use. And so that's kind of the upside of allowing the grief and the loss to coexist in you at all times. What about focus? Focus is sometimes something that gets lost when you're grieving because, again, grieving looks so much like depression. And having the inattention, the kind of frantic avoidance of the painful feelings can lead to a loss of focus. And so when you're able to step more into a place of calm and acceptance and joy, then you often regain focus and you find that you are more productive in the other aspects of your life, which is kind of a cool thing. Some other things about the grieving process, because people have different degrees of education and experience about all of this, that I wanted to mention is grief is something that is a highly individualized process. There is absolutely no right or wrong way to do it. There is no timetable for it, and it's something that is nonlinear. So what do I mean by nonlinear? This is actually really important because I mentioned that old model of denial, anger, bargaining, depression, acceptance, DABDA. It was something that was developed by Dr. Elizabeth Kubler-Ross, who most of us have heard of by this point, and it was specific to the process of coping with someone who is dealing with chronic illness that is terminal illness. And it became co-opted, I guess, into everything else, but especially with chronic illness. But it's something where the suggestion is that this is a very specific process that you're going to go through. First, you're going to have denial. You know, this isn't happening to me. This isn't a disease. This isn't a thing. Of course, I can still do all these other things. This is going to be fixable. Anger about it. We've talked quite a bit about anger already. Anger about all of the losses, all of the unfairness, the limitations, the fact that this is a rare disease, and so there's just not enough information about it or interest in it from people outside the immediate community. Bargaining. A lot of people will get into bargaining with God, with their doctors, with themselves. You know, I'll give up eating chocolate if only I can still walk for a little while longer. And bargaining just doesn't work, as we know. And then the depression. This is not going to change. I'm stuck with this. And theoretically, then you get to this mythical place called acceptance, which I just talked about. Instead of acceptance, and acceptance is a good goal, but you just can't go in a linear path through that. A lot of people wish that I could say, you know, at month 2, it's going to look like this, at month 6, like this, and at a year, you're going to magically be better. And instead, you might skip a couple of stages. You might feel angry for years. Bargaining may never come into the picture. Sometimes you hit acceptance, but then you get a test that shows you've lost 2% of functioning, and all of a sudden it starts all over again. And that is very normal. It's also something where, unfortunately, you don't just go through it once and get over with the process. It is, particularly with chronic illness issues, it's something that goes on in smaller and larger ways, depending, but it will go on for life. And again, this integration of grief and loss as something that is just part of living, I think is really important and helpful. So having no timetable to it also, there's kind of relief to that, isn't there? I mean, I find it to be relieving to not be expected to be held to a timetable. There are so many other things that we do or say or deal with where we have to be very careful. I know many of you have participated in clinical studies for different medications, for example, and you've got to keep logs of when you took the medication, how much of it you took, what you noticed. There are doctor's appointments we have to be at. There are many other things we have to do that are all on timetables. And it's okay that this grieving thing doesn't have a timetable. Again, no one right way to get this done. So I look at it as a process, as I said, not to be all Pollyanna-ish about it, but if we can release some of the expectations about it and in that process kind of embrace our own transformative process, we will have that experience, that desirable experience of transformation. And releasing your old body, your old expectations about what you look like, what you feel like, how you're functioning, the physical and emotional functioning too is going to change over time, and our expectations around that need to change with those expectations as well. So certainly you have your own list of experiences and stories around what has changed for you physically. I would imagine that each of you has similarly an experience of the emotional changes and that process of whether you're fighting it or embracing it, eventually coming to acceptance and release of the current emotional state, because it's not very fun, interesting, or healthy to stay in a state of denial or to stay in a state of sadness or of anger or rage all the time. All of those emotions are useful, good, appropriate, but any emotion, when you stay in it too long, and that would even include being just way too happy, it becomes dysfunctional. So I know that's a little bit of an odd idea, but we need all of those different emotional experiences in order to have our full experience of life. So without the contrast of joy, we wouldn't have that full experience of sadness. Without the sadness, we also wouldn't have that full experience of joy that we are all so aggressively seeking. Releasing some old ways of relating. One of the most painful things that I have found in working with people who have various chronic illnesses, and especially rare illnesses that people don't understand, or even I've heard where there's some expectations like, oh, is this catching? Which sounds so remarkably uneducated, but there are still many people who think that. You may go through some radical shifts in your relationships. I would be shocked if you had not lost some friends as a result of having this chronic illness. And that unfortunately seems to occur across illnesses. There are so many people who are not willing or able to be present with the complicated and intense emotions that come with accepting that a person is changing radically, may have more issues of dependence, or maybe more angry or moody or irritable because they're dealing with a physical illness. And sometimes people just are lazy. Maybe they don't care about you as much as they had once indicated to you that they cared about you. And so having the ability to continuously release some of these old ways of relating to people and dealing with the, in particular, dependence and independence as ways of relating, that sense of autonomy and how you have to give up little bits of that over time. Maybe even it feels like every day, because I know there's some times when it seems like there's a lot of rapid changes, and then you'll stabilize within what's going on with the illness. And releasing emotionally, actually saying to yourself the words, I'm releasing this experience, I'm releasing this fear, I'm releasing this pain, I'm releasing this grief. And when you're able to say those things, and if we were in a dialogue right now, I'd actually have you say those things out loud with me, because there's something, again, that really changes in your body. It's like you've probably heard that when you smile and you get that upturned corners of your mouth, it actually can start to change your emotional experience. Well, similarly, when you actually tell yourself the words, I am releasing this, I'm letting go of this, it can start to change your physiological experience. So is it going to cure you? No, absolutely not. I'm sorry. But it can lighten things internally, which allows the rest of your body to function a little bit better, a little bit more easily. Breathing will actually shift when you start to truly do those things. So releasing also dysfunctional relationships. It would be nice if we all had perfectly functional families, but we don't. So that is something also that can really get highlighted when you are dealing with the onset of an illness or major exacerbations, worsening of the illness, or changes in things like going from a status of being able to work to only working part-time to not being able to work, and how that changes things. You may discover parts of other people's personalities and characters that horrify you, that make you feel very unloved. And it's not usually my first choice when I'm working with my psychotherapy patients to cut out family members or friendships, but sometimes it really is necessary, and it's absolutely the best choice for you, because people who are mean to you, people who act with resentment towards you, people who act in unloving ways are not good for your emotional health. They're probably also not good for your physical health either. So just because you've got GNEM doesn't mean you're exempt from all the other physical symptoms and signs of illness or stress. I'm sure you still get colds and flu, for example. But it's something also where when we take in the stress of dysfunctional relationships, it can cause or contribute to the insomnia, high blood pressure, headaches, muscular tension, gastrointestinal distress, so like heartburn, diarrhea, constipation, stomach aches. There's a whole big long list of what being around toxic people can do to your body. Sometimes I get it, you don't have a choice about who you are with, but it may be something where you look at these relationships and decide to lessen your involvement with certain people, or you learn how to set stronger boundaries with them and tell them that they can't treat you the way they've been treating you, because it's not good for you, your physical health, your mental health, right? Because you're already dealing with an extra burden by having this significant illness, which is not just the physical stuff, something that once took 30 seconds now takes 5 minutes. That's the physical stress part of it. But there's also the emotional stress, which is the worry, the concern about how you're going to get through something, how you're going to manage something. What do you have to think through in advance in order to make sure that it works out okay? All right. Releasing also some regrets. Maybe you've had thoughts like wishing that you had done something earlier in life that you now physically can't do, or perhaps this is about emotional experiences. Releasing the fears and the shame that may be associated with having this illness, or not being able to do something that you once could do. Also the fear and the anxiety about what is coming next and how all of that's going to play out in your life. Embracing, and I know this is a hard work. You're probably sitting there going, what is she talking about embracing? No, you don't embrace this. This is awful. You reject it. But again, It's this idea of getting gentler into and with yourself and your experience of grief and loss. And so, to that end, focusing on what you do have, you may have more time to pursue interests that you have. You may have developed a much closer and deeper relationship with someone who helps care for you. You may have given up certain activities that were actually wasting your time, and now you find that you get to do more of what you actually want to do. Utilizing mindfulness and gratitude practices is part of this, just staying conscious rather than running away from what is making you sad or feeling that grief or loss, and practicing. Gratitude's gotten to be a very overstated sort of thing, and it sounds kind of trite, but the idea of keeping a gratitude list is a great practice. If you are feeling down, depressed, like you've got too much grief going on, what do you have? You might make that list in your head, or you might make it on a piece of paper, but it can be very simple things like having someone who cooks your favorite food for you, or listening to some beautiful music, or just, I keep those daffodils that are blooming right now in my living room so that when I'm sitting there watching TV or reading the paper, I can look over and see something that makes me really happy. And there's still plenty of things in life that are joyful. What can you anticipate about those joyful things? What can you celebrate? We don't have to have Pinterest or Instagram worthy lives. And that's the topic of a whole other discussion, is what is social media doing to us? But celebrating all of the moments that we have in our lives. I get pretty excited about good food. And I live with someone who will prepare really good food for me on a regular basis. I also like to cook. Those are things that I can anticipate with joy. But it may just be the eating of the food, or it may be seeing those daffodils coming every spring, or it may be other experiences in life, like knowing that you have someone coming to visit you, or that you are going to go out and go see the ocean. All of those things are very simple, small pleasures, but I think that they are often underrated. And when we are in a state of comparison, we lose some of the potential for joy. Also, embracing what you may have gained, what you may have released. Look at yourself and go, wow, I've gotten a lot more emotionally healthy in this process. I know so much better how to take care of myself, how to ask for help, how to receive help. Receiving help, by the way, is something that's incredibly hard for many, many, many people to do. And when you really do get to be good at that, that's also a gift of sorts. Embracing forgiveness also. Do you need to forgive yourself for some mistakes you've made? Do you need to forgive your caregivers? Do you need to forgive people out in the rest of the world, people in the healthcare community, for example? Sometimes they do things quite badly. They make mistakes. They are not as attentive as they should be. But all of those people can and should be forgiven. The transformation that can come from this, and I'm also conscious that we're getting down to our last couple minutes here. I'm going to take them because we started a couple of minutes late. But the transformation that can come could be something that's actually a very creative and spiritual experience. And by spiritual, I don't mean religious, but rather your own internal sense of connection to life, the world, other people, the process of living. And if it does involve religion or spirituality as a practice, those are things that can be transformative for you, or where you can transform some of your grief and loss and pain into creativity or spirituality. There's a great sharing that goes along with this experience if you choose to allow that, which is why I think it's so valuable to have something like this presentation, is that we, in a minute, will have an opportunity to share more about that. The transformation can also be about supporting and improving physical health. So while it appears at the moment that there is no reversing this disease, what I talked about in a couple places here in this presentation was that your sense of an emotional awareness and process around things like breathing, allowing the anger or the sadness or the grief to exist in your mind, to come to a place of acceptance and then to release them, actually contributes to supporting your physical health. It will improve your digestion, it will improve your sleep, it will improve your sense of well-being. Further to this, things that are transformative for you as well as the world, fall under the category of making meaning out of what is this horrible experience? Why has this happened to me? And what experience and meaning can I take from it? In a kind of non-judgmental way, again, approaching with curiosity, saying, this is just where I happen to be experiencing a lot of my grief and loss. And sometimes, and I see this in a great way for many of you, is channeling this into activism, like how we have Amy on the line right now. And part of her activism is making sure that you get to hear a program like this. Somebody has to be there to manage the technical side, and to make sure that things are scheduled and all of that kind of stuff. Beyond that, there are also outside supports. If you are really feeling that the grief and loss that you're experiencing are something that is beyond your own solo capacity to cope with, there's counseling, psychotherapy, there are grief and loss support groups, there are chronic illness support groups. I don't know that there's enough around the world to specifically support you with GNEM, but there can be a lot of support coming from people who don't have your specific disease as well. So now to conclude this, I am curious what your questions are, what your observations are, and what's been popping up in your mind as you've been listening to me for the last hour. And my question is also, what else is possible with this? How can you take this information and move forward with it and share with us if you would like to? There's no pressure here. But any of your experiences of grief and loss, of releasing some of these things, the kinds of transformation that you may have experienced if you have been embracing the process or if you haven't been embracing the process. So we're going to open it up for questions. Amy will be giving them to me because I unfortunately can't see the comments section. And if you have any follow-up questions or comments, I'm going to leave the next slide up, which is my contact information. You can find me on the internet. You can reach out to me, and I am happy to answer any specific questions. And I thank you for your time and attention today.
Thank you, Dr. Gretchen. We have one question that came through the chat.
Sure.
Wanted to know what your opinion is of using Cipralex.
Cipralex. Okay, for what purpose?
It is not stated in the question.
Okay, Cipralex is...
And also, what is Cipralex? Sorry, another question.
Yeah, that's... Yes, thank you. And I needed to pause for a second because I am terrible at remembering drug names. Okay, so the brand name is Lexapro. And that's a great question. Why did I deliberately leave that out? Well, here's the reason, because Cipralex, which is more commonly known as Lexapro, is a selective serotonin reuptake inhibitor. That is an SSRI, is what they're commonly called. And by way of education, an SSRI is the most commonly prescribed form of antidepressant medication. And I am not opposed to using medication, and they're called psychotropic medications, so some people call them psych meds. I'm not at all opposed to using medication, but I have a big caveat about it, which is medication, such as an antidepressant, does not fix grief and loss. It can fix things partially and not always. So antidepressants in general are about 50% effective. When I'm working with someone who has mild or moderate depression, I very rarely would suggest to them that they try an antidepressant. They're going to get farther and faster without it. It can be something that causes you to have less of your full experience of depression or grief or anxiety. That being said, unfortunately, what happens a lot of times is when somebody comes in with symptoms of depression, grief, anxiety, related things, the first thing that will be done is, hey, take this antidepressant, take this anti-anxiety medication. And then there's always side effects, not necessarily to the same degree or limits for all patients, but it's something where you may have a long period of time before you find the right medication for you, or a medication that's effective. And sometimes the medications just aren't effective because it usually takes about 2 or 3 weeks to start noticing positive effects of an antidepressant medication and about 6 weeks to see the full effects. So you may not be on the right dose, you may not be on the right medication for you, it may not be enough, it may be something that has side effects that are intolerable for you. So I'm a moderate fan of medication where it's needed. I think it has to be considered within the scope of your very specific and individual body chemistry. How depressed are you? And with grief, sometimes people actually become suicidally depressed. And so that's something where I would say it's always justified to use a medication like Lexapro, because we want to get you out of that depressive state as fast as possible. So super personalized kind of thing, but I always ask a lot of questions and ask, is this really the best approach, or is it something where I'd be better served by practicing meditation every day, by expanding my social circle, by getting a little more sleep, by changing up my diet so I'm getting more green vegetables and healthy fats, which help contribute to brain health? Is it something where I need to get out and get some sunshine? Is it something where I need to journal my thoughts? Those things are often equally or more effective than a medication. So that, I know, was a bit of a long answer to the question, but it's probably a question that a lot of people have. But the bottom line is that medication is not going to fix grief. It will potentially fix some depression.
Thank you. Does anybody else have any questions?
No more? I hear someone talking in the background.
Oh, that might be my fiance
Okay.
in the background.
Okay. Does he have questions?
Yeah.
Not to put him on the spot.
Yeah.
Or do you have questions that when you were getting this presentation together, were there some questions that were coming in or some other themes that I may have missed that I should address?
There was questions of how to try to explain to someone when you're having a tough day and they just don't see it that way. They're saying, just buck up,
Yeah.
change your
Okay.
attitude. How do you?
Yes, that's a great question. So that's a hard one because, the stuff that I've just talked about for the last hour in terms of the grief and loss issues, and I've mentioned caregivers a lot because I know that that's a context where that comes up. For a lot of people who are in your family or your friend circle or caregivers especially, they kind of there's this expectation that they be constantly cheerful, optimistic, that they're not just there to assist physically, but also emotionally, to shore you up. And there's sometimes this pressure to like, okay, I can't fix anything physical, but I can fix your mood. I can fix your mood. So I'm going to force you into it. I'm going to talk you into it. Like, cheer up. Come on, let's laugh. Let's get going. Let's be energized. And that's hard because sometimes that's just not how you feel at all. And so for both parties or all parties to be mindful about the fact that it's okay. This is all normal. There's going to be days, hours, moments where this is sad. It's hard. It's overwhelming. It's thoroughly depressing. And just to accept that and to know also with some sensitivity, and this may be a bit of a big ask, but it's like, allowing yourself to have the space to have those feelings, but also to say when someone's kind of trying to force you to cheer up, hey, I'm just really having a bad day. I had a bad doctor's appointment, or I noticed something changed, or I can't feel this. I am really sad. I've got a right to my feelings, and please just let me have my feelings for a few minutes. I will be better in a few minutes. But also for them to be aware, sometimes the depressive feelings can get really strong. And if those do go on, then it is going to be their job to get some professional help to fix that problem. But I think it's hard because there's this thing that we've talked about somewhat in the groups is, there's this pressure to be kind of a better than average human being when you have a chronic illness, because I don't know what it is, but there's this idea that somehow there's something noble about the suffering, and that it's got to give you a better personality or a more, better way of thinking, more perspective on life. And so you've accepted so many things so far that you should be able to accept everything gracefully. And it's not true. It's just not true. People with chronic illness are totally normal, average people with all sorts of feelings of anger and frustration and annoyance and all of those other things as well. And so there can often be this idea of kind of the accepting sick person. And I think especially when you're talking about something where you do have some physical stuff, that there's this expectation somehow that you be better behaved than everyone else and grateful, which is another thing that's got to rile some tempers. Why should you be grateful because people are treating you decently? And so I think all those things come in and can get complicated within the scope of relationships, because we're not all psychologists. And even when we are, we still have those kinds of messy feelings.
Thank you. That was good. Anybody else have any questions?
Hi, it's Mona from the UK.
Hi, Mona.
Hi there. I thought I'd have lots of questions, okay? And but everything you've said has really resonated with me, and everything, it's so spot on, the things that you've talked about.
Wonderful.
And the sense of the loss of the sense of self, feeling dependent on people, things like the cultural values of family, especially coming from an Indian background, and being a wife, a mother, a daughter-in-law, a daughter, a sister-in-law, all these identities that I have, and having to dealt with all the emotional baggage, and the shame, and the constant explaining about the difference in my body year on year,
right?
All those things, and the kinds of things that I do is like exactly what you said, and that is to be really kind of honest with the people who I care enough about to be honest with.
Yes.
And those people that are just, I call them dementors, like from Harry Potter, the people like you said who are toxic and they take away all your good energy.
Right.
I just have very clear boundaries, or I've cut them out, like you said. And I, at one point, I felt guilty about that, but I don't feel guilty anymore.
Don't feel guilty. You have to do what you have to do in order to take care of yourself the best way, because every day you're already dealing with something that's depleting your energy, both physically and emotionally.
That's right. And I don't need people in my life who are just going to take away the one little bit of peace or energy that I have. They're not going to take it. I just don't let them do it anymore. Even at work, if somebody, does something, it's not related to my disability, but it's something, then I'll just try and be the better person and think, well, I'm going to learn from that. And next time I'm going to say something, or I'm going to say something there and then, and not let it affect me again, or try and rise above it. But, it's easier said than done.
It is definitely, but yeah, you also mentioned something just about being a mother, which I know you have one child, two children?
I have just one. Yeah, she's nearly 17. Yeah.
Right. So I know when you become a mother, you are instantly thrust into this role of being everyone's mother. And somehow the expectations are even heavier on women in their multitasking roles. So you have a job, you have a body that requires extra care. You have this child also who's now nearly an adult, but this expectation of caregiving once built in, and this is especially more impactful for women, is this perception that we're the nice girls, we're the nice people, we take care of everybody, we smile and we keep going even when things are difficult. And that changes a lot when you have an illness or a disability, and the ability to set the boundaries like you're talking about is really powerful, and I think it's very protective. It conserves your energy. Like there's enough to feel bad about in life without all of these negative energy people throwing nastiness at you.
Yeah, and I'm thankful I don't have any bad energy around me anymore. But you're right, the only time I get really protective, fiercely protective, is when it affects my child, like it would for any mum, I
Mhm.
suppose. And
Right,
things like,
right.
you know, having to deal with the fact that she's a young carer, you know, and I've got to live with the fact that she's
Mhm.
gonna, you know, I know that I'm thinking in my head of the future as well, like, well, if and when she has children herself, I'm not going to be able to be the grandmother or the nanny that, you know, I always wanted to be.
Right.
So that's something I've got to, you know, that in my head I try and turn it around and think, well, okay, I may not be able to change nappies by then, or, you know, do
Mhm.
other things, but at least I can still bestow my wisdom and my personality and my stories and experiences, and just
Exactly.
be there, you know. So I'm trying to offset it with it. It's not the same, I'll be honest. It does feel like really unfair that, you know, we're not going to have the same experiences as other people, but at the same time I'm still here. And, you know, when I think about other people who have lost lives at a young age or lost their cognitive abilities, then I
Mhm.
actually think really I'm thankful for the fact that I have what I already have. So
I
everything you've
think
said to me is affirmed, you know, that I think I'm doing things right.
I think it sounds like you are, and I think it is something where having that perspective that, like you said, maybe you won't be able to change the nappies, but you will perhaps be an amazing storyteller to these grandchildren, or you will be somebody who really teaches them what it's like to love and be loved, because something about what's happening in the disability sense has forced this greater reliance and interdependence that's actually a great modeling for how to be a healthy human being.
Yeah.
And that's a much bigger gift than being able to change the nappy.
And I think a lot of children around me currently, like my friends' children who've grown up seeing my disability evolve, if you want to call it evolve, progress or whatever,
Yeah.
have seen, you know, if anything, it's made them more enlightened about disability, and they find
Hmm.
me fun because they can come and use the stair lift at my house, or they can have a little ride on my scooter or wheelchair, and you know, so
Yeah.
it's or when the really younger ones used to love playing with my walking stick when I used to walk with a walking stick, and it was
Right.
a bit of a talking point. So it's kind of nice that
It is,
they can learn.
and your work actually is in disability services, if I remember correctly.
Well, I cover all the 9 protected characteristics under the Equality Act, but I tend to lead
Okay.
on disability highly because obviously by
Okay.
virtue of my own experiences.
Right.
Yeah, so I'm very passionate about it.
Yeah, but that I think is something that's really actually exciting and interesting, because you can cite the statistics better than I can, I'm sure, about the number of us who will go through permanent disability, temporary disability, that sort of thing in life. But making, in the general sense of how we are all operating as a people on a planet and a society, is that the idea of fear of the other, and
Mm,
what you do just by existing and allowing children to be curious about, oh, she has this walking stick, or she has this scooter, or whatever it is, it normalizes and it makes it
that's right.
easier. Because
Yeah,
yeah, as we know, when you get to know someone, when you get to know someone who is from another culture or a different religion, then we see people becoming friends and caring about each other, instead of having these biased or inappropriate ideas about what it means to be the other. And the same thing with matters of disability, or partial impairments, or even things like more psychological issues. Someone who has a mental illness is not necessarily dangerous, they're just
no,
different.
that's right. Yeah, and there's a lot of dignity and nobleness in getting to know somebody with with depression or some kind of mental health condition, because you can learn from each other. I think you can learn different strategies off each other, and that's
Right.
really important. I think, and like you're saying, that it's quite transformative. I got into this work because of having GNE myopathy. Before
Mm-hmm.
that I was an administrator, just doing a 9 to 5, not really, just getting the job done and not totally content. But if anything, it's changed my path, and
Right.
and I love it now. So it can be transformative, and it is getting to a point now where it's getting tiring
Mm-hmm.
and challenging. Just trying to find like, if I've got to go to a new building for a meeting, for instance, I don't know if I'm going to be able to use the toilet facilities, for instance, and be able to get
Right.
off and not feel vulnerable.
Mm-hmm.
So I have to think, right, I have to really think things through. I have to take somebody with me. I have to make sure I've got a support worker,
Yes.
you know, all these things. But then at the same time, I'm thinking, well, you can still do it. You can still do it. So don't,
Mhm.
you know, don't stop yourself from doing anything. Still focus on what I can keep doing. And that's what I keep telling myself. So it is
Yeah,
hard though.
it is hard, and that's the thing. I think there's this whole other layer of things, you know, and I sometimes hear terrible things from people who are kind of thoughtless, like, oh, isn't that fun? You get to ride around in a wheelchair and skip to the head of the line. And I'm
Yeah.
thinking, what?
Yeah.
There's there's
It's okay at
probably
Disneyland.
oh, I know it's great at Disneyland. I
Yeah.
live close to Disneyland. Um, but you know, it's one of those things where people have these really wrong ideas about it. And it's like, I'm sure you would gladly trade going to the end of the line. Maybe not at Disneyland, but
Absolutely.
you know, it's something where the ability to gently educate people about things so that they begin to see a different experience and the reality of it. Because what you're talking about, that having to plan ahead, having to research, you know, where is an accessible toilet? You know, is it something that's truly accessible or just barely past the measuring standards and there's no way I'm actually going to be able to use it?
Yeah.
And other people don't have to think about those things. I may
No.
not like it if I'm hitting 7 flights of stairs when I go to visit a historical site, but I can deal with it.
Mhm.
You can't just magically fly up the stairs.
No. Thank
And
you for
so,
that.
yeah, those are things where I think that there's stuff that's just, it's that constant sort of thing. And there's like a constant low level stress or anxiety about this having to research and plan and think ahead and what is
Yeah.
the workaround.
Yeah.
um, you know, and how do I make this happen and continue to have as normal and full of a life as possible?
It's true.
We have
Yeah.
another
Yeah.
question from the chat.
Okay.
How can we prevent children from feeling the difficult situation we live in, that it will not harm their personality in the future?
I missed the first part of it, but it was how can we protect our children?
How can we prevent our children from feeling the difficult situation we live in, that
Okay.
it will not harm their personality in the future?
Okay. So that's a really interesting question. Um, and what I would say to that is I'm not sure that that's the best goal, because the reality is that if your children are going to continue to be part of your life for forever, they are going to know what's going on with you, and to try to keep it from them in some way um, is not going to be helpful for you or for them, because they need to know the reality of what your life looks like so that they can best adapt and help you. They may need to know the reality. It's also something, because of genetic linkages, it may be something that they themselves are dealing with in the future. And for them to have the full picture of what's going on and see you modeling a healthy way of approaching the situations is really important. So like what Mona was just saying right now,
Mm.
I know that she wants to model healthy things for her daughter, for example, and to have a full life and get out and about. I've seen some pictures on Facebook,
Mm.
you know, where she's been doing things with her family and that sort of thing. And that's something where the reality of it is children are really smart. Like they're kind of
That's true.
scary smart about emotional things.
They are. It's true.
You know, adults think they can be all tricky about it, but I get really interesting situations, you know, where maybe a parent died unexpectedly, and you know the surviving parent makes up a story about it, and then I'll talk to the kid alone, and they're like, oh yeah, I knew, but my mom didn't
Mm.
want me to know, so I just pretended like I didn't know that dad died from a heart attack. And it's like, oh my God, you were 4 years old. How did you know this? They know things.
Yeah.
So it's a lot of extra work also. Like anytime that you're trying to keep things in secrecy, first of all, this is not a judgment on the person who's asking the question, but it's teaching and perpetuating the shame and the embarrassment around this. And people who have a disability are absolutely equal to everyone else as human beings. We all have the right to exist as we are. And a significant percentage of us have some sort of something going on with our physical or mental health that is actually not perfect. And so the more that they can know, see, accept, understand that, the healthier those kids are going to be. it actually contributes to emotional and mental confusion for them if they're seeing one thing and being told something else. And so I'm a really big advocate for being honest in an age and situationally appropriate way with your children. There are some kids who are just the most brilliant little souls, and they're 4, 5, 6, 8 years old, and they just have this heart connection and they totally understand and get it. There are other children who may themselves be dealing with some sort of physical or emotional disability or impairment. I'm thinking specifically like of kids who have autism spectrum disorders. They may not have the literal capacity to process the information. So just like you would be very age appropriate in talking to and teaching your children about money or sexuality or any other sensitive subject, you don't need or want to give them all of the details of what's going on, but you do want to let them know that things are a little bit different, because children also have a tendency to imagine. They have this thing called magical thinking, where they imagine that they are the cause of a problem, or that that they are the one, like the reason that you are low energy, sad, grumpy is because of them, when in fact maybe it's because you had some messy problem dealing with healthcare access that day and you're just so depressed about it. A child will take in that energy and think, I was bad, I did something wrong. And so that's actually counterproductive. So again, you've got to know your own child or children and calibrate your responses to them, and look at them from a developmental sort of way. And what can they actually handle? They may not need to know, and I'll just create a totally different scenario here, but like they may not need to know that daddy is dying from cancer, but what they do need to know is that daddy doesn't feel well. Sometimes he has to go to the hospital, and maybe he is going to be an angel sometime in the future. It's like that would be how you might talk to a young child about it. So I would say really think about that. If you have a spouse or partner, other family members, talk about it, but do know that kids are so smart. They're just scary smart about emotional stuff.
And I can just echo that, because my daughter, from young age, again, she's seen me with different challenges throughout
Right.
the journey, and I went through that stage when she was younger of thinking, oh my God, it's unfair for her to deal with me, and the fact that I can't go and kick a football with her, or go and do all these other things with her. But then a good friend at work said to me, but just think what a great role model she's around. You're setting her an example of that. Doesn't matter if there's negativity or adversity in your life, that she can overcome that, and she can see that through you. And also, another friend said to me, look how resourceful she is. You're teaching her to think outside the box. If, she's not going to become one of these mollycoddle children who doesn't
Right.
appreciate that life is going to throw challenges to them, because we're not going to be around them all the time. So I do feel like she has that slightly added edge going forward in life,
Right.
through experiencing what she experiences. And you're absolutely right, she's completely in tune with me more than any of my caregivers. And
Yeah,
that's the
that's not
scary thing,
surprising.
because when
Right.
she's not around me, or she will go to university, hopefully, that is a fear that I have, that, oh my God, I'm losing not only my daughter, my heart, but
Of
also
course.
one of the best caregivers that I have. But I want her
Yeah.
to spread her wings and go and
Right.
do what she has to do.
Right.
And that's something I've just got to deal with, because I know I've got other people, and I still will
No,
have
but
a
that's,
life.
and I didn't touch on that, because that's another level of loss, which is that like when she does go to university, you will be losing your best
Yeah,
caregiver, the one who's most
yeah,
in tune with you. And
yeah,
that's something aside from just the empty nest syndrome. You're going to be
yeah,
sad because your beloved child is out of the house, but those things, and also this idea of children who do have a parent who is also a patient of some sort, they do tend to become more emotionally mature more rapidly. But this is not a bad thing, as long as they're not thrust into a role of constant full-time caregiving. But if they are, like the one who's sensitive to, oh, mom might actually need a blanket on her lap, or, she doesn't actually like her eggs cooked that way. Can we redo them?
Yeah, that's
Um,
it. Yeah.
yeah, those little things, those are great, and those are sensitivity, and there's bonding around that, and you'll probably end up with a closer relationship than you would have otherwise. But I would also say that for children now, there's a lot of not allowing them to fully blossom into their
Mm,
own sense of self and independence and responsibility. And when they get these opportunities, which can come in many forms, it could be because you're the oldest child of 5 and you get into that caregiving role too, but it gives them a lot more confidence that they can take care of life. Like, I would bet your daughter knows how to do laundry. She knows how to cook.
that's
She
right.
knows how to go grocery shopping. She doesn't have to have you do that for her.
That's right.
And those are really valuable life skills. So I think that as long, again, as it's something that happens in an age appropriate and responsibility appropriate way, like not trying to turn that child into an adult when they're 12
Mm,
years old, or misusing them in some way, for them to just know what's going on, and, maybe not the full emotional experience of anxiety, dread, grief, depression, but
yeah.
don't lie to them by hiding,
Yeah.
basically, is what I would say around that whole thing. So yeah, those are some really great questions. I'm glad that a few of you were able to get your questions answered. And
Thank you.
again, I'm here if you have anything else that you need. And really thank you for your time and attention. This was a really interesting conversation to put together. I do a lot of work with grief and loss, but I actually did this from scratch, and reconfiguring and really diving deep into what the GNEM experience is. So I'm glad it resonated.
Thank you, Dr. Gretchen. It was very valuable to us.
All right, good. I am glad. I will talk to you soon. Take care, everyone. Have a good weekend.
Thank you.
Thanks. You as
Bye.
well. Bye.
Thank you, everyone, for attending.
Bye.
If you need to get in touch with us or Dr. Gretchen, you can always email us and we can give you her information.